Recording and you're good to go.
Okay, you gonna ask me questions, or you
Well,
just want me to start speaking?
You can just start speaking, then I'll ask you the questions.
Okay. Um, Good evening. This is India Kincannon, Mayor of the City of Knoxville, and I have issued an executive order for the City of Knoxville, allowing employees of the City of Knoxville to enforce the Knox County Health Department's Safer at Home order. I adopted word for word the Health Department's order that they issued last week, and this empowers the City of Knoxville employees, our codes inspectors, our fire inspectors, our Parks and Rec employees, our KPD patrol officers to enforce the provisions that the Health Department passed last week. And I'm really doing this not because I'm into draconian measures, but because this is such a serious problem. And over the last week, people have had a week to understand the nature of the order and to comply with it, and many people have. But over the weekend, it became clear that a lot of people were not taking this seriously. We had people we posted signs up in all city parks saying that the parks were for passive use only, and yet there were many people who ignored those signs. We had people breaking into padlocked tennis courts and pickleball courts. I've heard reports of people having, food truck parties where, you're allowed to go to food trucks and you're allowed to have events outside, but people just need to maintain that social distance. And that means at least 6 feet apart. And that is not to be mean or to hurt business, it's to save lives. Social distancing is the only known way to stop the spread of coronavirus. And just this week, we've had the number of cases in Knox County more than double. So and they keep going up every single day. So I issued this order to empower the City of Knoxville to enforce this order and just make sure that people and businesses and everybody understands the serious nature of this.
All right, now I'll ask you a couple of questions.
Okay.
You already answered one, but can you expand upon the extra step from last week?
Well, the Health Department issued this order, and again, my executive order takes verbatim the Health Department's language and just makes it an executive order for the City of Knoxville, giving the City of Knoxville employees the power to enforce it. So people can report issues and concerns and questions through 311. They can call 311 Monday through Friday, 7 a.m. to 5 p.m. or email 311office@knoxvilletn.gov. And that's one way to report an issue. And this is just to help people understand the serious nature of this and to help stop the spread of this deadly virus.
What legal authority do you or the council have to do one of these?
Well, about 2 weeks ago, I declared a state of emergency, and that is based on 2 Tennessee code laws, and also the city charter allows the mayor to do that in cases of emergency. And since then, I issued an executive order related to closing gyms and fitness centers and making bars and restaurants carry out only, and closing commercial venues. And this is an executive order, another executive order relevant to the same exact laws and the same exact state of emergency. So it's just an additional step. And again, it's to just help people take seriously the need to practice social distancing and use our parks, but maintain 6 feet of social distance. Go to the grocery, but only go when you have to. Try to minimize your visits to the grocery, and when you're there, keep 6 feet apart from other people. And we want to encourage customers to do that and empower store owners to help them enforce that, because the clerks at these stores and groceries and pharmacies are also vulnerable, and we want to make sure they're safe and protected as well.
You were talking about the different people that could come in and enforce this. What happens to violators?
Well, the very first step is just educational. A lot of people still are not aware that social distancing, what it means and how important it is, and that it not only protects them, but it protects our doctors, our nurses, our firefighters and police officers. And so it's an act of solidarity and community mindedness to protect the whole community from the spread of this virus, because we have amazing teams of emergency responders, we have amazing medical facilities, but when if they all get inundated at once, then it'd be really hard for us to maintain the integrity, the ability for our hospitals to respond. So it's about flattening the curve. It's about getting people to take this seriously. And the main point is to educate people and make sure they know about this safer at home order, and then follow it. Most people are very willing to cooperate as soon as they're aware of the issue and what the motivations are behind it.
And about the parks, why not just close the parks, and what are the extra security measures or extra measures that you're going to implement?
Well, we put signs up like this at all city parks. Our Parks and Rec and Public Service employees are working as fast as they can to take other measures like locking up and taking nets down, locking up tennis courts and pickleball courts. Not because we don't want people to enjoy recreation, but if you're playing basketball and one person out of a 10-person game is unknowingly carrying the virus, every person who touches that ball could catch it. So we're doing this to do our part and stay apart and encourage other people to do the same. We don't want to close down the parks because passive use is healthy and safe. We just want people to maintain a healthy distance. If they're with their family, the family members that they live with, then you can be closer together because those are the people you're living with. But you just want to minimize your contact with other people.
And then you've got some greenways that are both city and county. What would happen if the county doesn't enforce the same one that you are?
Well, the county health department is already, they're the ones who issued the safer at home order, and they're already enforcing it. When people call 311 up to the past week and report an issue, we have been sending that to the health department for investigation and enforcement, and their team has been working on that. We're just adding the full heft of the city of Knoxville to help with that effort. It's a combined team effort, and education and enforcement is necessary to just help the whole community understand how serious this is.
And now we're just going to go slightly off topic. We've been getting calls about from viewers about homeless gathering underneath the bridge and the social distancing concerns about that. What would you want to say, and are there any possibility of citations to the homeless?
If you take a minute to read the health department order, the people who do not have homes cannot possibly comply with this, and so they're not subject to being issued for violations. However, we want to take care of the health of our homeless neighbors as well. So we are in the process of working with community partners, Metro Drug Coalition, Volunteer Ministry Center, and the health department to find a place. We have a place, and we're going to be announcing details probably tomorrow about where this is going to be and how homeless neighbors who have been tested and need to be quarantined while they await the results will have a place to do so. It's a very challenging issue and hard to coordinate the medical care and the facility, but we've been working on that for several weeks, and now we're thinking that it'll be able to be open and available in the very near future. So of course it's impossible for people without a home to stay at home, but we're trying to find accommodations to make it work for them as shelter and for their medical needs.
Are there any exceptions to social distancing, such as a church wants to do one of those drive up and get a bag and drive away? Are there any
drive up and what?
Like some of them are giving out bags of food, toiletries and stuff. Are there any exceptions to what happens to them? So they can drive up.
The order says that gatherings of 10 or more are not allowed. So I know it's not a strict ban, and we have our constitutional rights, and that's really important. But I know most churches care very deeply about the health of their congregants, and so many churches, I've seen different churches and faith organizations handle this in different ways. Some people are going to online services. Some people I saw their parishioners were in the lawn chairs out in a parking lot, and the pastor was delivering a sermon through a megaphone. And of course, many churches and faith-based organizations are helping with our food pantries and helping bring groceries to elderly people and people who can't get out, and helping with mobile meals. And that is all wonderful, and we need as many people who can help in that regard to continue doing so, but just to make sure they're doing it safely. If you're feeling sick, obviously you don't want to be volunteering bringing meals to people, but if you're healthy and able to help deliver meals and stock food pantries, we need people to do that. There are many churches that you can volunteer through them. Also Volunteer East Tennessee is a great coordinator of all kinds of services. There's a lot of ways for people to help if they have the capacity and energy, and their own health is good enough to do that. We also need people to donate blood. I donated blood 3 weeks ago, and they were really looking for, there's no risk to donating blood, and if you're healthy, you should donate, because in the middle of the COVID-19 crisis, we also still have people dealing with regular medical issues, cancer treatments, car accidents, all the things that hospitals and the medical teams normally deal with are still going on, and they're preparing and for the COVID-19 people who need hospital care.
What about like nonprofits like CareCuts, which is right down from the homeless center? They the other week were doing spots where they were putting bags down that had peanut butter jelly sandwiches, a Gatorade, stuff like that, 6 feet apart. What would you want to say to that, just the nonprofits?
Well, I appreciate the people who are providing food. We have a group working with the Emergency Operations Center that's coordinating food, not just for young people. The school system's doing a great job in partnership with the Parks and Rec Department and many other entities to bring food to children who would otherwise be getting their meals at school. And CAC and many other groups are working to bring food to other vulnerable people, including the elderly, people who don't feel safe going to grocery stores right now, that sort of thing. So I would say if you need help with food, call 211, and they are the social service hotline to help you with food needs and other social services. I would say any entity who is providing food should practice the CDC guidelines, about wearing gloves and making sure people are social, practicing good social distance practices, 6 feet apart, washing hands, not touching their face, all those things.
Is there anything else that you want to add?
This is a really hard time. We're having a hard impact on our economy, but the alternatives of not following the best public health practices will be even harder on our health and our economy. So I encourage everyone to take the Safer at Home order seriously, and if you see any issues, call 311, and we will work together as a community. It's going to take all of us to get through this, and I know that we can do it together.
I think that's perfect.
Okay, thank you.
Thank you.